Well, I'll need a second pair of hands. Okay, so here we have C1, which is known as the atlas, C2, which is known as the axis. What makes the axis, so C2, quite unique is that we have this bony protrusion called the dens. So what happens is in this anatomy, the dens, this is a little bit dramatic, but the dens will sit inside C1 like this. So this is what a normal C1 and C2 should look like. Not 100% normal, but just as normal as we can get today. The reason why we're talking about this is because we want to make people aware on who you're choosing as a bodywork and knowing what their education is and understanding that they understand how anatomy works and how biomechanics of a horse works, if that's being the entire horse or just localizing to either the cervical vertebrae, thoracic vertebrae, the pole, whatever it may be. So with further dissections that we have done through the school, we have found a little bit of discrepancy between C1, C2, if that's a matter of injury, but specifically we had a horse that was sent to us with neurological symptoms. And with those neurological symptoms, we were lucky and fortunate enough that the owners decided to donate the horse to us. And after doing our autopsy on this horse, we decided to boil down the bones so we can show the public some things that we see from incorrect manipulations of certain chiropractors and body workers out there. So unfortunately, this horse did suffer quite severely. So as we talked earlier, C1, normal C2, we can tell that they are separate. This one, unfortunately, is not separate. This horse did not have any significant injury to our knowledge. So you can see that this is now becoming one piece, not two separate pieces. And we can see the amount of remodeling that is happening underneath C1 and C2, so your atlas and your axis. All of this little fibrous, dense material here is the bony remodeling that we have. And you can actually see, if I were to hold this straight up, there is quite a significant rotation happening. And we probably have some sort of spinal cord, potentially impingement, causing a neurological symptom. We don't have a straight line going through. And so if I compare the two on the table from side to side, just for the camera, so you can definitely see some major changes. There is no separation. These are completely fused together, right? There's definitely a bit of a rotation that was happening in through this horse. And I will flip it over for you, just so you can see the difference.
Oh, look how crooked that is.
Between the two bones. So, lesson learned is please ask your body worker what their education level is, how much experience they have. Has there been any severe injuries done to your horse? Because this is going to determine and change the nature of a treatment, because we can potentially hurt these horses, and we're here to help these horses instead of causing more further damage to your horse.